Hello, my name is Nawaf Al-Maqbil. I'm a medical student. Can I have your name, please?
Abdurrahman.
Okay, Mr. Abdurrahman, how old are you?
I am 22.
Okay, I'm here today to examine your abdomen. I'll be looking at your face, neck, and extremities, and your abdomen, of course. Is that okay?
Yes.
Okay, do you have any pain before we start?
No.
Okay, I'll start by washing my hands. The patient is not connected to any devices or oxygen tanks. He has no IV lines or NG tubes. He looks comfortable with normal breathing pattern. He is well nourished with normal body build. Now I move on to inspecting the patient's face. Could you look up, please? Okay, there is no pallor. Could you look down? There are no signs of jaundice or xanthelasma. Moving on to the oral cavity, there is no angular stomatitis. Could you open up your mouth, please? Good oral hygiene, normal mucosa. There is no dehydration, ulceration, or growth. Could you stick out your tongue, please? And no signs of central cyanosis. Moving on to the neck. Could you look other side, please? And there is no raised JVB. Okay, you can come back. Inspecting for supraclavicular notch and suprasternal notch. They're both normal. Now moving on to lymph nodes. I should warm my hands first, starting with the submental lymph nodes. Moving to submandibular. Then the pre-auricular and the post-auricular. Anterior cervical and posterior cervical. And finally the supraclavicular lymph nodes. Now moving to the chest, there are no signs of gynecomastia or spider nevi, and the patient has normal hair distribution. Moving to the hands, there is no muscle wasting or palmar erythema. There is no splinter hemorrhage, leukonychia and chylonychia. Could you do like this for me, please? And there is no finger clubbing. Could you stretch out your hands, please? And there is no flapping tremor. Moving on to the arms, there are no tattoos or needle scratch marks. Now we move on to the lower limbs to check for edema. Inspect the ankle for edema, and if edema is present, we should press above the medial malleolus, 1 inch above the malleolus, to check if it's splitting or not. With the patient lying flat, and I should expose the patient from the xiphoid process to mid-thigh. Okay, and I should also place 2 pillows, one beneath his head and one below his knees. I start with general inspection for the abdomen. There is no discoloration or pigmentation, and there is symmetrical movement with breathing. There are no scars, rashes, or striae. There is no abdominal distension or distended veins, and there is no obvious pulsation. The umbilicus looks normal. There is no inversion or umbilical hernias. Now I move on to auscultation. I should auscultate the 4 quadrants to listen to abdominal sounds or bowel sounds. Then moving on to bruise, start by aortic bruise, just above the umbilicus. Then renal bruise, above the umbilicus and slightly lateral. Okay, now I move on to percussion. I start by percussing the 9 regions of the abdomen. Do you have any pain before we start? Now I move on to percussing the liver to determine the liver span, starting from the right superior anterior iliac spine. Then start from the third intercostal space. So it's within the normal span, which is 4 fingers or 6 to 12 centimeters. Then percussing also for the spleen, starting from the right anterior superior iliac spine and moving diagonally. Okay, now we move on to percussing the bladder. Okay, now we're done with percussion. We move on to palpation. I start with superficial palpation, palpating the 9 regions of the abdomen. Looking for tenderness or about tenderness or guarding. Now we move on to deep palpation. Now I move on to palpating the liver. Okay, I need to take a deep breath. Again. Again. Okay, again. Okay, the same thing with the spleen. Okay, take a deep breath. Again. 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 One last time. Okay, now to the gallbladder. I check for the Murphy's sign to check it's positive or not. Put my hand under the right costal margin. To take a deep breath. Okay, the Murphy's sign for cholecystitis is negative. Now to the bladder, palpating the bladder. Okay, now we move on to the kidneys. Okay, and the same thing with the other side. Okay, and finally palpating the aorta, checking for any abnormal pulsations. Before we finish the exam, we need to perform 2 special tests. The first one is shifting dullness for mild to moderate ascites or fluid in the abdomen. The other one is fluid thrill for severe ascites. We start with shifting dullness. I percuss from abdomen till the umbilicus, then moving to the side until the resonant voice becomes dull. Then ask patient to roll to the side. Could you roll up, please? Okay, ideally I should wait for 30 seconds, then percuss again, and the area that was dull will become resonant again. Okay, you can come back. Now for fluid thrill, I need you to put your hand like this. Okay. And in case it's a fluid or ascites, I'll feel waves of fluid hitting my other hand. To complete my examination, I should thank the patient and help him get dressed, wash my hands, and summarize my findings. I should also perform a digital rectal exam and fecal occult blood testing and check for the radial pulse, popliteal pulse, posterior tibial, and dorsalis pedis. Not to forget to check for hernial orifices and perform external genitalial exam.